What is oral insulin? It is a very important topic of discussion, which is a research project for the last 100 years. How to get oral insulin? First, we want to know about the insulin. We know we have an organ in the body which is called pancreas. It has its head, body, and tail. About 50 to 70% of pancreas is composed of beta cells, which is responsible for the secretion of insulin. It is called Islet of Langerhans, the area in the pancreas which has beta cells. And who was Langerhans? Langerhans was an MBBS student from Berlin who discovered the beta cells inside the pancreas. Which is a very important organ for the production of insulin. Insulin, the word insulin has been derived from insula, which means island, because it's an island in the pancreas which is composed of beta cells which secretes insulin. Insulin is a peptide composed of amino acids, which is responsible for the metabolism of fats, carbohydrates, and proteins. Beta cells inside the pancreas are responsible for the secretion of insulin. So it was an important discovery made by Langerhans, and further research was carried out on beta cells of pancreas, and it was known that it secretes insulin. We know about the oral hypoglycemic medicines which are used for the control of diabetes. And we have insulin, which is used either subcutaneously or intravenously. Insulin is a peptide. Peptide means which is composed of amino acid. It is a protein. As we discussed, the insulin is a peptide molecule. It has beta chain, which is composed of 30 amino acids. It has an alpha chain, which is composed of 21 amino acids. There is a disulfide bond between beta and alpha chain. The gene which is responsible for the insulin is INS gene, which is located on chromosome 11. It encodes for the amino acid for the proteins which makes insulin. We know that we have 46 chromosomes. These are the chromosomes. With the short arms and long arms. Now we have to count, and on chromosome 11, on this chromosome, there is a gene, INS gene, which is responsible for the production of insulin from beta cells. As we discussed, insulin is composed of two chains. The beta chain, which is composed of 30 amino acids, and the alpha chain, which is composed of 21 amino acids. There is a disulfide bond, two disulfide bonds between the alpha and beta chains, and one disulfide bond within the alpha chain. Is a one disulfide bond. These disulfide bonds that hold the two molecules together. Now we know that insulin is available in injectable form. We give it under the skin or intravenously inside the veins. We have different types of insulin like Humulin or NPH insulin, Glargine or the long-acting insulin, different insulins for the treatment of diabetes. Mostly we have injectable insulins which are given subcutaneously or intravenously. We give it in different parts of the body. Deltoid or the thighs, which has many complications, decreased compliance, and episode of hypoglycemia. There is a research, can we get the insulin in oral form? And what are the challenges? There are many challenges due to which we cannot make the oral insulin. We haven't made it yet. It's not impossible. First challenge is a peptide, and it can be degraded in the stomach by the stomach acids. And that's the reason more than 80 years have elapsed and there is still ongoing research. The other challenge is the thick layer of the mucosa of small intestine. Normally we eat proteins and they are degraded by the stomach acids which are ready for the absorption in the small intestine. But insulin is a long peptide, as we discussed, two chains, alpha and beta chains, is a thick wall, and this amino acid, this protein, insulin, cannot be absorbed, which are the two big challenges. Now, how to overcome these challenges? There is a nanotechnology which is used and which is still under research, that the capsule, small capsule, should be formed in which the insulin are given and which are resistant. The capsule should be resistant to the stomach acids. But another challenge still is there, which is the thick wall of the small intestine. So when the capsule is taken, if it is absorbed through the small intestine, it will go to the bloodstream. And it will mimic the physiological insulin which is secreted inside the body by the pancreas. They will not be directly secreted in the bloodstream, and there will be decrease or no complications. No hypoglycemia will be there, and there will be increased compliance to the insulin if we are successful.